My topic is convex ST for smile and reuse of lenticular of smile for post-LASIK ectasia. So this is, as we know, China has been catching up in the world in the field of refractive surgery from RK to smile. And by now, my team has finished more than 50,000 smile procedures as the very good efficiency, stability, and safety. We also published some papers in GIS and other journal of refractive. And the advantage of smile was better vision and better outcome and better vision quality and more safety, low impact on corneal biomechanics. So here I would like to present the change in corneal deformation perimeters after lenticular creation and extraction during smile procedure. Our purpose is to investigate the effects of the lenticular creation and the subsequent corneal lenticular extraction on corneal deformation perimeters during smile procedures. So there are 18 eyes of 10 patients, which was 27.9 years old with minus 5.64 diopters, which was involved in the schedule for smile procedure and deformation perimeters, including deformation amplitude DA and AT1 and AT2, and AL1 and AL2, and CV1 and CV2, with peak distance, radius, and intraocular pressure values was measured preoperatively immediately after lenticular creation and subsequently to corneal lenticular extraction with the convex ST. So, which means the patients just before to the operation bed, the convex ST measured all those data, and after the creation of lenticular, without the next step, and move to the slit lamp and to check and then to measurement with convex ST. So all these convex demonstrated there are significant difference between the creation and extraction lenticular, and there is no significant difference between the preoperatively and the lenticular creation with femtosecond laser. This image was just after the creation of the lenticular with femtosecond laser, and this image shall displayed after extraction of the lenticular, and there are such a significant difference after extraction, which means there is no significant difference in the creation. What I mean is, if we scanning the lenticular, there is no effect to the deformation perimeters of the convex ST. So the conclusion is there's a significant change in the corneal deformation perimeters following a smile procedure. The change may be caused predominantly by stromal lenticular extraction, while lenticular creation with femtosecond laser may not have no obvious effect on those properties. So, which was already published in GIS, and it indicates that there is difference between femtosecond LASIK and smile, as femtosecond LASIK may have the flap effects because the flap was cutting with femtosecond laser. Though I would like to present the next observation with comparison of corneal deformation perimeters after smile, LASIK, and femtosecond LASIK. In this retrospective study, there are 17 eyes of 17 patients after SMILE, 18 eyes of 18 patients after LASIK, and another 17 eyes of 17 patients after femtosecond LASIK were included. The corneal deformation perimeters were measured also with the COVIS-ST system, which was done 3 months post-operatively. The mean values of deformation amplitude of femtosecond LASIK group was significantly higher than that of the LASIK group, and the mean value of A1 of LASIK group was significantly higher than that of femtosecond LASIK group, and there is no significant difference was detected in the mean value of the A1 between LASIK and the SMILE group, or between SMILE and femtosecond LASIK. The multiple linear regression model analysis revealed that after adjustment for age and preoperative central corneal thickness and manufacturing refractive sphere equivalent, and those was displayed as follows. The LASIK was 7.35, femtosecond was 7.17. There was the p-value was 0.043, but compared with femtosecond with SMILE and LASIK, the p-value was over 0.5. So these displayed the SMILE, LASIK, and femtosecond LASIK. There is significant difference between SMILE, between LASIK and femtosecond LASIK. There is no significant difference between SMILE and LASIK. So the significant difference in the mean value of A1 and between LASIK and LASIK was p-value was 0.8 and 0.0589. In all 3 groups, the value of A1 negatively correlated to those of A2, SMILE, LASIK, and LASIK, which was displayed here. So LASIK and LASIK, there is something, a difference, but the SMILE are very close to LASIK. Now the conclusion is A1 and GA as measured with COVIS-ST may be helpful in assessing corneal biomechanics changes after corneal refractive surgery. The relation between those parameters should be discussed in the future studies. So this is my mini lecture here. Thank you very much for your attention. And I may last, but I would like to say something about, by now, in my clinical practice, I use COVIS-ST for preoperative screening because, as we know, we have the Rodman's papers as a guide to pre-screen for safety of refractive surgery. So sometimes the pancake topography is not enough. We have to combine with COVIS-ST. For example, this patient was female, 31 years old. Almost 4 years ago, she came for SMILE, asked for SMILE surgery, as the corneal thickness was 486 micron, and the left eye was 490 micron, with post elevation or posterior elevation was +9. So something like there is, I didn't do it as because the thin cornea. So after the follow-up, when she was follow-up because she was pregnant, so we didn't do surgery for her. And until 2007, January 2007, so the patients topography changed a little bit, almost the steeper 0.6 diopter. And at that time, I still didn't do the surgery for her, as we detect with curved ST as the T bed was 2.78 and the TBI was 1.0. And the OS left eye is very similar, 2.89 in bed index, and the TBI index was 1.0. So we just recommend her to do the spherical lens implantation, and we stopped to do fusel. And another patient, for example, the case 1, we also use, if we only look at the topography, we may have no idea about the subspective keratoconus, but if we did the measurement with curved ST, the TBI was 1.0, and left eye. So sometimes we also need combined with wavefront, as this comma was a little bit higher than normal. This is another left eye. Is a corneal topography is normal, but combined with the TBI is abnormal. Also, when we detect with wavefront, we find the comma has increased a little bit. The third left eye, 0.74, so it's suspect. Here also the comma increased a little bit. TBI was 0.9. A comma increased a little bit. So for these patients, the posterior elevation is normal, and the shape also is normal. Bedding display almost normal, except a little bit zone with yellow. So this right eye was normal, TBI 0.12. Normal. As for left eye, almost normal, normal. So which shows the anterior elevation was not a good index for detect keratoconus. We have to combine with mostly posterior elevation of corneal and the shape, and the bedding, a bed, and the TBI. Sometimes we need add wavefront index. Thank you.